In the early 1950s, in the narrow lanes of a forgotten leper colony in Karachi, a small group of women from the religious order of the Daughters of the Heart of Mary, along with a local dermatologist, began serving quietly. They had no roadmap, no vision of scale, only compassion and the courage to stand with those abandoned by society. No one could have imagined that this humble service would one day give rise to Pakistan's National Leprosy Control Program. In 1956, this work took formal shape. The Mary Adelaide Leprosy Centre, MALC, was registered, marking the birth of an institution rooted not in ambition, but in conscience. In 1960, a young German doctor and nun, Sister Dr. Ruth Pfau, arrived in Karachi, not to stay, but to apply for a visa to India. At the invitation of her congregation sisters, she visited a leprosy colony near McLeod Road. What she saw was unbearable. Open sewage, rats, human beings living stripped of dignity, crawling on the ground. Dr. Pfau was deeply distressed, thinking no human deserved to live like that. She told the sisters she could not work there. But that night, sleep eluded her. Her thoughts returned again and again to the faces she had seen, and somewhere in that restless night, a calling emerged. Maybe our Lord wants me to stay for these people. The next morning, she chose Pakistan. History quietly changed. At the time, leprosy had no cure. Treatment was lifelong, and almost no one was willing to work in the field. Dr. Pfau led a small, fearless team, DHM Sisters. People affected by leprosy themselves and handful of lay volunteers, most of them women. Patients began arriving from across the country. It became clear that leprosy was not a local tragedy. It was a national crisis. In 1961, during the Queen of England's visit to Pakistan, a German journalist visited a leprosy colony and encountered a German doctor working alone. His report reached Hermann Kober, head of the German Leprosy Relief Association (GLRA), who wrote to Dr. Pfau, "How is it that a German doctor is working for leprosy in Pakistan and the German Leprosy Relief Association doesn't know anything about it?" Dr. Pfau replied, "How is there a German Leprosy Relief Association in Germany and I don't know about it?" And in 1962, a partnership was born, one that continues to this day. Through GLRA, the people of Germany opened their hearts to the people of Pakistan. As it is often said here, leprosy was controlled in Pakistan by the people of Germany. With GLRA's support, Dr. Pfau began traveling across Pakistan, meeting provincial health authorities, district officials, and medical leaders. Her strategy was simple and transformative: train Pakistanis to treat Pakistanis. Young men from every province were brought to Karachi and trained in leprosy diagnosis, treatment, surveillance, and reporting. This became the National Leprosy Training Institute, the backbone of Pakistan's response. In 1963, MALC acquired a clinic in Sadr. Despite fear and resistance, it grew floor by floor into today's 8-story Maryam Manzil. In 1968, the government of Pakistan formally partnered with MALC to launch the National Leprosy Control Program, a pioneering public-private partnership. The program expanded relentlessly, from Sindh to Khyber Pakhtunkhwa, from Balochistan to Azad Jammu and Kashmir, from urban centers to the most remote valleys of Gilgit-Baltistan. By the 1980s, 157 leprosy control units were operational. Hundreds of paramedics were trained, leprosy services were integrated into government health systems. This was not charity, it was system building. In 1996, Pakistan achieved what few nations had. Leprosy was controlled nationwide. 4 years ahead of the WHO target, Pakistan became the first country in the Emro region to reach this milestone. But MALC understood a crucial truth. Control is not eradication. To protect decades of progress, MALC evolved. Its infrastructure and expertise expanded into tuberculosis control, prevention of blindness, mother and child healthcare, community-based inclusive development. The goal remained unchanged, not merely to treat disease, but to heal people and restore dignity. In August 2017, Dr. Ruth Pfau passed away. Pakistan mourned and honored her with a state funeral, a tribute reserved for those of greatest service to the nation. But MALC did not falter, because leadership transition had already been prepared. Marvin Francis Lobo, who had served alongside Dr. Pfau for 27 years and as CEO since 2012, stepped fully into stewardship. Dr. Pfau often said, "It was my Pakistani boys and girls who did the work." Under local leadership, her vision endured, not as memory, but as momentum. Under the new leadership, MALC strengthened governance, expanded partnerships, and reaffirmed its commitment to inclusive development. While advancing the Zero Leprosy agenda, MALC also responded to emerging unmet needs, particularly among children with disabilities. In recent years, with the support of provincial government and DEPD, MALC has taken a decisive step into specialized rehabilitation for children with neurodevelopmental and physical disabilities. Through its Centers for the Rehabilitation of Children, MALC now provides early identification and assessment, physiotherapy, occupational and speech therapy, support for children with autism, Down syndrome, cerebral palsy, and developmental delays, family counseling and caregiver guidance. These centers reflect MALC's deepest belief that inclusion must begin early and that every child deserves a chance to thrive. In 2024, MALC launched the Roadmap Towards Zero Leprosy, aligned with WHO Global Strategy guided by 4 pillars. Country-owned roadmap, scaled-up prevention and early detection, disability prevention and complication management, stigma reduction, and the right to dignity. The vision is clear: zero infection, zero disability, zero stigma. From a forgotten slum to a national health system, from incurable disease to global achievement, from one calling to 70 years of service. This is MALC, one of the longest standing service providers operating under a public-private partnership model. A legacy of compassion, a future of inclusion.